Community Medical Center's Pediatric Specialty Center gives the littlest patients access to care in various subspecialties, including pediatric, adolescent gynecology. Doctors in this field treat and diagnose gynecologic problems in infants, children, and adolescents. Thank you so much to Dr. Angela Hernandez for joining me today. She is a pediatric adolescent gynecologist. What is pediatric gynecology?
So pediatric gynecology is a subspecialty of obstetrics and gynecology. In order to be trained in it, you do a 2-year fellowship in specifying between birth up until around the age 22, focusing on programs or problems of newborns and young children as well as adolescents. In newborns, one of the most common things that I get asked about for my opinion would be newborns who are born with what we call ambiguous genitalia, meaning when you look at the private parts of that baby, it's really unclear if it's a female infant or a male infant, somewhere kind of in between. So I generally will work with other subspecialties like genetics, endocrinology to kind of figure out what is the genetic makeup of this child. Does this child have some sort of condition leading to excess hormones that have caused his or her external genitalia to develop improperly? And then spending time with the family and the patient and kind of working through how he or she will identify in the future and kind of what to do cosmetically about that area.
So that's at a newborn age, and then what about toddler ages?
For toddler ages, the issues I tend to see are kind of effects of hormones or the lack of hormones. One of the common things in girls between maybe 0 to 3 that I will frequently get called for would be, if they're concerned that the labia are fused. It's something called labial adhesions. It's just due to the fact that at a young age, these girls don't have the same estrogen that an adult woman would have, and the area gets kind of stuck together. It's not an emergency, but a lot of people do look at it and they're like really alarmed by it. Kind of later on, kind of 3 to 7 area, a lot of things I get called for would be topics on hygiene, discharge, odor, concern that their kid might be developing too fast. Maybe they're seeing breast development or pubic hair development sooner than they think is appropriate. I do frequently see preteens for just kind of development concerns. Maybe they feel their period should have come a little while ago. Where is it? What's going on? Am I delayed? When the periods do come, things like painful periods, irregular periods, a need for birth control, or just kind of the need for birth control counseling.
Why is it so important that adolescents in the Central Valley have access to pediatric and adolescent gynecology's specialty and seeing a specialist like yourself?
Teenagers in the Central Valley, although nationally the teenage birth rate has gone down. Working over at CRMC and seeing the population on the obstetric side, we still do have quite a high teen pregnancy rate. I feel that by being in the Central Valley and kind of being exposed to the population early on, whether it's from when they were 7 years old with a vaginal discharge, or later on coming on just for contraception counseling, that I can make an impact in that sense.
Final question here. What tips may you have for parents who have, daughters of young age or that preteen teenage? What tips do you have for them?
Yeah, well, it is definitely a challenging time. The American College of Obstetrics and Gynecologists recommend that women starting at the age of 13 to 15 visit a gynecologist, but there's really no need to wait that long. If there are some questions, if there's really no reason to suffer through your period anymore, and if the parent doesn't feel comfortable talking about the subject, or maybe doesn't feel like their pediatrician or their primary care doctor feels comfortable talking about it, that's why I'm here to kind of help them out.
Excellent. Thank you very much to Dr. Angela Hernandez for your time. Thank you.